A 65 years old lady is recovering from major abdominal surgery in ITU, and as part of the clinical care, a clotting screening is performed. The prothrombin time is noted to be increased. Which of the following condition below is unlikely account for these findings? So first of all, let's see the clinical findings. A 65 years old lady recovering from the major abdominal surgery in the ITU. And as a part of clinical care, clotting screening performed and prothrombin time, which is the PT, prothrombin time is increased. So which of the following condition is unlikely? That means which is not responsible for increased PT. That means the prothrombin time. Here the options are cholestatic jaundice, disseminated intravascular coagulation, prolonged antibiotic treatment, liver disease, and acquired factor 12 deficiency. So what is the cause which is not responsible for reduction of the or increase the prothrombin time? Here let's see the heparin first. The heparin, it prevents activation of 2, 9, 10 and 11. So this point is very important. In the heparin, it factor affected 2, 9, 10 and 11. The second option is the warfarin. The warfarin, it affects the synthesis of the 2, 7, 9, 10. And the DIC, in case of DIC, what factor reduced? It is 125, 8 and 11. And in case of the liver disease, there is a wide range, which is the 125, 7, 9, 10, 11. So the different type of the clotting factor, they are affected by this different type of the chemical substances. Also here we can see in case of the vitamin K deficiency, it increase the prothrombin time. So vitamin K in this patient, prothrombin time increase. That means there is the affection of the vitamin K, and this vitamin K, it inhibits warfarin. Here we can see this is the warfarin, and warfarin, it affects the synthesis of the 2, 7, 9, 10. So vitamin K deficiency, what happens? It reduces or it affects 2, 7, 9 and 10 clotting factor, and also this factor is affected by the warfarin. Actually, what warfarin do? The warfarin, it inactivates vitamin K. So 2 point, one of them is when the warfarin, more warfarin, it blocks 2, 7, 9, 10. Also the vitamin K deficiency, 2, 7, 9, 10 deficiency, and the warfarin, it affects the function of the vitamin K, and it also increases the prothrombin time. Vitamin K deficiency results from the cholestatic jaundice and prolonged antibiotic therapy. And so vitamin K deficiency occurs from what? From the cholestatic jaundice, also from the antibiotic therapy, and also from the warfarin, So warfarin, what does warfarin? It affects the clotting factor, which is the 2, 7, 9, 10. So vitamin K, cholestatic jaundice, antibiotic therapy, warfarin, they blocks 2, 7, 9, 10, and it increase the prothrombin time. But factor 12 deficiency, it causes the increase APTT. It is not PT, it is the APTT. So our answer, what is this? This is the acquired factor 12 deficiency. Acquired factor 12 deficiency, it increases the APTT, it increases the APTT. On the other hand, the cholestatic jaundice, it reduces vitamin K, and vitamin K dependent clotting factor, which is the 2, 7, 9, 10. Disseminated intravascular coagulation, which is the DIC. DIC affects almost all of the clotting factor. Then prolonged antibiotic therapy. This prolonged antibiotic therapy, it also reduces vitamin K. Also the liver disease. In the liver there are different type of the clotting factor produced. So when liver disease occurs, it cannot produce this 2, 7, 9, 10, and also produces increased prothrombin time. So only the factor 12 deficiency, it is not associated with prothrombin time prolongation. It is responsible for the prolongation of the APTT.